I started on reception back in May last year. I was taken on part-time, so it was 22.5 hours. Just wanted a complete change really. I'd been a careers advisor for a long time, wasn't happy in my job and just wanted to start somewhere completely new. We were allowed to do a day in the life of, so we were asked by our manager, would we like to go up into the call centre and sit with the different staff up there just to get a better idea really of who we were working with, because obviously being on reception we didn't get much chance to speak to them about their jobs. So we did a day in the life of, and as part of that I sat with health information, and that's when then I decided that's what I'd like to do if I stayed within the NHS. I wanted to move on and work in health information. For example, say somebody's been to the GP and they've been diagnosed with a health problem. In that appointment they haven't had time to ask the GP more about it, what it means, how it's going to affect their lives. We could research that for them in great detail, only using sites that we're able to use, and we could send out that information then from those accredited sites for that person to have all the information they need to be able to sit at home, read through it with their families. So we've got the time really to be able to do things like that.
She obviously wanted to develop herself within the service and was very enthusiastic and had a wealth of experience working in other posts. And we have recently started training her to become a health information advisor, so she'll actually be working within the call centre, dealing with members of the public, which for her is a really good career development, and it's a fantastic opportunity for the service where we're getting the skills that she's got and we're developing them to support the service delivery.
I like the thought of helping people. I like the thought of providing a service that is individual to that person. So rather than giving a blanket service, that person is ringing in or is emailing in for a specific reason, and it's my job then to find that information, research it and tailor it to that individual. And I like the idea of providing that service, and rather than the careers advice of things, which is more tailored to what's available for people to be able to do, this is actually completely, this is your health query, this is what you can do, this is what's out there for you, self-help groups, things like that. And I just like the thought of being able to give that advice to somebody and helping them.